Here
Please
we go.
note, this session is being recorded.
Yeah, I've seen a lot of people, and the problem is the general public is looking at journalist articles, and
Well, they're paid
they're
for it, so yeah, they're trying to scare the crap out of people, so they'll come
right.
to their site.
But the journalist articles, they're taking them as like God's word from a virologist. I said, no, you idiots. This is an interpretation by a journalist of what the scientist said, and they got it wrong.
Yep.
Absolutely.
Yeah.
We'll be back to normal soon. But oh, I got good news. So
What's the good
finally, several of our companies received their economic injury disaster grant, the advance, today. So two of our companies, Chris, right? DSCS, Guru got it. I don't know about Breakthrough or Global. They didn't.
No,
I don't think they got it.
Breakthrough didn't get it because when I put in the application for Breakthrough, the funding had already ran out.
Well, they're
Same
refunding
with
that.
Norwalk.
They're refunding that.
Oh, good. And maybe we'll get it later. You know, as long as we did it, like if we did it for Norwalk too, maybe we'll get it later, like in a few weeks.
I didn't do one for Norwalk. I told you that. I'm doing that. I did that under DSCS.
Okay, I got you. Okay, so that makes sense. So then we got that one. So those are starting to come through. So hopefully other sites, you know, I know we had Marjorie on last week, are getting theirs, which is good. You know, and then the PPP needs to kick in for some. I know you applied, Chris, as well. So yeah, like a little bit of good news. And then we got hey Monica, we got a coronavirus. We just got off a call with a coronavirus study that everybody who's collaborating is working for free with Dr. Hazen, who was on earlier. So we're the CRO. So then we were talking about how this is going to be beneficial for our CRA Academy students, and possibly even the CRC Academy students. I didn't even think about it, but I think, and Monica, you're on mute. But I think this coronavirus project that we're doing may even benefit the CRC Academy students. What do you think, Chris? They could be more like assistants.
Yeah, they could be like CRA assistants, sure.
Well, I think
we got good news.
It's a great idea for like your data entry because it's going to be flooded.
That's right. Yeah, so the sites will be doing there's two sites. They're going to be doing their own data entry. And then everything will be electronic, like the stores. Obviously, DC is electronic. I hooked them up with Viva Vault, which is doing free e-reg. So then for our coordinating interns, I guess they could be like kind of like assistants, and then the CRA Academy interns will be the actual CRAs, you know, monitoring, writing reports, all that stuff. And then I'm the lead CRA along with Chris. And Monica, I don't know, we'll give you some role. You can be I don't know, what do you want to be? You could be something. You could be lead CRA if you want. I don't want to.
We'll see.
I reached out to Dr. Zahn. I'm working with a couple sites trying to get them on board to donate their time to do it. I'm trying to meet with Dr. Slanker, who's the infectious disease doctor at our local hospital. They have a research collaboration there, so maybe Dr. Agarwala can, spearhead that.
That's good. You know, keep yourself busy, Sherry, because like the more you do right now, I mean, obviously I don't need to tell you, but the more you do, like the more you are building your repertoire, you know, and then it's just going to open you up to more opportunities. Like this project that we jumped on with Dr. Hazen. I mean, we've been introduced to all the other stakeholders, and who knows, like when we get another project, we may need one of them for something, or vice versa. Right. So it's always good to, you know, activity and action is the only thing that matters. You know, not thinking about something. Like that book you recommended, Monica. The unscrew
And
yourself.
fuck yourself.
Oh, thank you. YouTube's gonna demonetize, but it's all good. It's all good.
Oh, sorry.
It's all right. I'm not editing this, so
Okay.
I don't
And
have.
Yeah.
F yourself then. And F yourself.
They say action. Nothing else matters but action. So doing
Yeah.
something for free. This is what I try to tell Sherry, all the students that come through our class. Why would I do this for free? Doing something for free is much better than not doing anything.
Right.
All right. If it's going to propel you in the right direction. Now, you could do something for free that's horrible. Okay, that's
Right.
obviously not good.
But in reality, it's not for free because they are building their professional life. So at the end
Right.
of the day, the one that get the benefits from doing this internship or whatever for free, the only one that is getting really benefits is the one that is doing this for free, the one that is putting his time or her time
Right.
to get experience. So
Well, you
it's
know,
not for free.
a little off the subject, but I had this conversation kind of with my grandson in just the recent week. My grandson is very cute and he is interested in modeling and acting. So he has an agent and we've been working with him. And I said, you've got a role. And he goes, well, no, Meg. He goes, am I going to get paid? And I said, no, you're going to do this for free. I said, because the only way to get where you want to be is to build your resume. And you're
Exactly.
unknown right now. So get your name out there. Somebody will see you. You now have something on your resume, which somebody else doesn't, who is behind you on this. I said, so you take the free roles, you get your name out there. Somebody hears you, they see you, you know,
It's
you go
always
from there.
somebody's always going to see it. And then on
Yeah,
top of that, when you scratch somebody's back, that person is going to scratch
right,
your back too, because if they know about any other opportunity out there that they know it suits you and it will give you payment, they will just tell you, hey, this opportunity is out there, you might want to take advantage of it, you know?
yeah, yeah,
and
yeah.
and
Take advantage.
so
And an opportunity like that, where you're learning something or doing something new, is a skill set that you're gaining.
We need Sherry as a guest lecturer in both academies immediately.
Oh,
Because people
you
are
know,
tired of
yes,
hearing from me and
please,
I
Monica.
used
yes, please.
I used to do training and mentoring for junior CRAs, for people fresh out of school and wanting to get into the industry. And one of the first things we used to do with them, I said, okay, your first assignment, all of you go out to dinner by yourselves tonight. And they were like, really? I said, yes, that's your homework. I want you to go out to a restaurant, sit down, order a meal, and eat it by yourself in that restaurant. And they all came back and they said, that was the hardest thing I have ever done. I said, that will be the remainder of your career in this industry, monitoring.
Well, if that was the hardest thing they've ever done, true first world problem there.
Well, you know what I mean, though, to have the confidence to go sit out
Of course,
and,
of
I've
course.
done
you know,
it. I've done it in college, and it was like very weird and very bad feeling. Like I'm like, man, I'm actually here at this restaurant by myself. Like my freshman year when I didn't know anyone, that's what I did, and I was like, geez, I can't do this anymore. I got to do takeout now.
yeah, yeah,
It's
you
tough.
know,
It's tough.
you know,
Have you been at the movies by yourself?
yeah,
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 I've done that. I've done that.
I
yeah.
went to a Rocky Horror Picture Show by myself and freaked out.
When you're at the movies by yourself, nobody can really identify you. The lights go down, the movie goes on, everybody's engaged,
That's
Yeah,
right.
but
but
That's right.
people, when you go outside, people think you're a weirdo because you're going by yourself to the movies.
Yep. My freshman year of college, I did that many times because I had no friends yet. I just moved
yeah,
there and I didn't know anybody, but I wanted to go see movies and I wanted to go eat, so I did it by myself. I brought a newspaper with me to the restaurant and made it a little less awkward, but still.
yeah. But no, training new CRAs or people that want to get into the industry, I think is interesting because you see a lot of personalities going on, and then you see like, who wants, there's people that come into it and say, okay, I've made it, this is going to be an easy road. And then they get down to the brass tacks. It's not easy. There's a lot of self-sufficient reliance that you have to have. You have to think on your feet. You have to come up with solutions or ways to maneuver and get what you need done from the sites, from the sponsors. It's like being a really good used car salesman sometimes.
Yeah, no, that's such a good analogy, actually. The analogy I know what you're trying to prove is, hey, when you're a CRA, like that's gonna be you a lot of times, right? Is that what you're trying to say? Like you're gonna eat by yourself a lot of
Oh, of
times?
course.
Yeah,
Because where
yeah,
my brain was going initially when you started this analogy, I agree with that one too. But my analogy was, this is like being on LinkedIn and not networking with anyone. Like, what do you accomplish from that? You're just sitting there. Like,
right,
so networking, that's where my mind was going, but both of those
right.
analogies work. I mean,
Well, I, and it all depends too. Everybody comes from a different perspective with their life and their resources at home and what they deal with. I'm a mom. I'm a grandmother. I have a husband who's visually impaired, and he's not a big honey-do list kind of guy. He's more the honey call somebody kind of guy. And I was at a site with a trainee the one time, and I said, I got a phone call, and I said, okay, you're going to need to pack your bags. We got to go, because I had a family emergency. Called the company, let them know, explain. They were like, do what you need to do for you. I was racing to the airport. I called a pizza shop near me, gave them my credit card number, had dinner delivered for my kids because my husband was in the hospital, and got a plane back in time to be home before they went to bed. And she's looking at me. She goes, I would have never known to even think to do this kind of thing. I said, you have to know what your biggest resource is, because you're going to do this and have a life at home, and you're it. You are your most reliable resource. You have to know what you're doing and how to do it. She was almost in tears about the whole thing. And it was my family, mess going on,
right.
but you have to learn to adapt. What are your resources? How are you going to get from point A to B? And what happens when you get laid over because of a snowstorm or tornadoes in the middle of the country? You know, hotels are booked. What's your next plan? Where are you going to go?
Right. You are your best resource. This is very true.
So take it for what it's worth, but it's a learning curve. And everybody's going to experience something different. I wish I would have taken a little bit more time to stop and smell the roses at some of the places that I was at, because you don't necessarily get to go back to the same place,
Right.
How much of the country do you see besides the inside of the car, the inside of the airport, the inside of the hotel?
Yeah, good point. I mean, a lot of these people think CRA is going to be, a dream job, and I always tell them, okay, you're going to think that until you're actually doing it, and then you're
Mm-hmm.
going to want to open your own site, which
That's right.
we've seen the whole cycle. Chris, at least once a week, we get reached out to by a CRA that wants to open a site, right? For like the last year, this has been on
Oh
average,
yeah. Oh yeah.
easily,
No
right?
doubt.
I'm
Yeah.
not even
And that's,
exaggerating.
and that's not easy either.
No, it's not easy. It's
Yeah.
not easy. People feel like, and like you, I'm sure, like, now that we got to know your story a bit too from these meetups, people feel like there's a certain group of people that want to work for themselves because of something deeper than just money, and that those are the true entrepreneurs that make it, because the money, like when you start out on your own, the money's actually worse than if you
Yes,
were like a senior level, full-time employee, or even
right.
mid-sized level full-time employee. Like, you're taking a risk, but the reason, this is why you have to have your why. And somebody said it earlier when you were sharing your story last week. You found your why. And, people don't want to hear that stuff. They're like, yeah, Dan, this sounds great, but, I want to start a CRO and make money. Well, you're in for a rude awakening, because a CRO is probably the least glamorous company there is in research. I mean,
Well,
in my opinion.
you and I had a conversation outside of this group,
Yep.
in reference to somebody starting a CRO.
Yep.
Okay. I
Yep.
was all in to help them.
Naughty, naughty.
Okay, hold on. That put a $497,000 hole in my income.
My God.
Hmm.
See? Yeah.
I'm not the only one. And that's the one I warned you about.
Mm-hmm. Mm-hmm.
So, and I mean, right now it's probably about a million and a quarter that he owes different people.
Wow. So this is like
So,
work you actually did, like you like billable hours that you did on his behalf, basically.
yep. Oh yeah. Yeah.
Yeah.
Over and above working for myself.
And
So,
and what happened? He went out of business, like he went bankrupt, or what? What is the
no,
issue?
he's opened up 3 or 4 other companies now. That's why I warned you.
Mm-hmm.
And that's when I saw that one name, and I saw that name, I was like, you need to warn him if you know that guy, because I'm going to tell you what's coming. And he's opened up other companies offering full-time employment, 401ks,
Wow.
yes, he's got 3 others.
Some of these people belong in jail instead of
Um,
being business owners.
well, the police department, the district attorney, my attorney, and the collection agency that I'm dealing with all have the same goal.
Good.
So, it's hard in this industry to badmouth somebody, because that can damn your career right there. But
Yeah.
I don't want to see other people fall into this kind of trap.
I mean, look, your reputation's all you have, and somebody like that's building a brand for himself,
Yeah,
also.
yeah,
Right? I
yeah,
mean, that's what it is. It's the negative side of having that's
right,
his brand. Whatever people think of you is your brand. You don't control that. Your
yeah.
actions maybe control it if you're lucky, and the messaging you put out controls it. But other people's thoughts of you is your brand, whether you like it or not.
Well, it's funny. I called up the management company that owns the building that he rents, and they have the same problem, because he's into them for some rent. And they said, not a problem. Let us open the door. What do you want? I took every document I wrote, every FTC, every training document, all the GCP stuff. I wrote it. You didn't buy it yet. It belongs to me.
Hmm.
And they were a labor of pain. SOPs are like on my short list of things I hate.
Oh yeah, that, and I've never written a full protocol, but I've written with Chris a synopsis. Oh my gosh, that was like harder than writing our book.
Oh,
Our book was like
see,
200 pages. The
I
synopsis
love
was like
being
30 pages. I hated that.
I loved writing. When I first started out, the company I was in was very small, so we all did a lot of things, but we used to have protocol development teams, and I loved being on that.
I mean, in theory, it's fun, but like when putting pen to paper or like fingers to your Microsoft Word, it's a lot different for me, at least.
Well, when you come in there, you got a medical writer, you got a medical monitor, you've got a statistician, you got clinical people. So it was a group effort. So the shell, and that's where you have to start, is you have to have like a template, an SOP, and a template on your protocol shell. It has
Yeah,
all the bits and pieces. So then you're only moving the particulars for an indication.
right. Yeah, we had none
I
of that. It
That
was
makes it
just
so much easier.
we had a blank Word document and a client that said, "Do this for me." And he paid us a lot for it, so it was worth our time. and he never even did anything with it. It's like he wasted like a lot of money on that synopsis, and
Yeah.
it's not like he had coronavirus as an excuse. This was years ago. The
Hmm.
economy was doing great, so just didn't want to do it, I guess.
Well,
Um,
if you
interesting
ever get in
trivia here.
there again, let me know because I got a couple medical writers and some protocol development people. Actually,
Absolutely.
my husband's a PK scientist, so
Okay, yeah, absolutely. This is why we're doing these daily meetups, to meet with people. Literally, what we're doing every day. Have you ever done a 510K submission?
I haven't done the submissions. I hate that part of it,
I hate
regulatory.
that too.
But hey, you know what? I'm willing to give anything a try.
Yeah, it's when you look at the way it's structured, it's not that complicated. The hardest part is researching like the predicate device. So that's where all your man hours go into is like researching other predicate devices that are similar,
Yeah.
and then putting it all together. Monica, you wanted to share something. Monica called me today when I was on the treadmill, and I was like breathing heavy, breathing hard and breathing heavy, but I got to keep the lungs strong these days, guys. And then you said you wanted to share something with the class, and I have no idea what you want to share. What is it?
Oh no, with you.
Oh, just with me. Okay, okay. So this is not
Yeah.
what the Guru Nation meetup. It's not for their
Uh,
ears. It's not for their ears. I
I
understand.
don't think you will want me to do that.
Okay, okay, I got it. I actually have no idea what this is. No idea. How's it going on the studies, though? You texted me that there's new studies as well,
Yeah,
right?
we have to schedule 2 site selection visits over the phone.
Okay.
So yeah, those are
Uh,
for CNS studies.
Yeah. Hey,
you,
Monica, Dan told me to reach out to you about getting a protocol synopsis on the ophthalmology study.
Okay,
So I really just need inclusion exclusion. I'll send you over an NDA later today.
okay,
All right.
all right.
I was going to kind of shop it around to a couple ophthalmologists.
Okay, I have one, but it's been hard to get a hold with him
he's
because
at
of this.
Costco. He's an ophthalmologist at
Yeah.
Costco, but he has his own office too. And
Yeah, he's young and he's interested in doing this. I already spoke to him. He's actually my ophthalmologist, and when I went for my appointment, I told him about it, and he was interested. So I
That's
know he
that
is,
actually
but
brings a good topic because like going to like in this case going to Costco or like for general medicine maybe going to Kaiser and seeing a doctor there. A lot of those guys want to do studies, but obviously you can't do it inside Costco or inside Kaiser. It's not gonna they won't allow that to be a research site. They're just not gonna allow that. But a lot of times these guys and gals have their own practices outside of
Mm-hmm.
Costco. So you can go, like that's like a magnet for these guys and gals, but you can then set up something with them privately, like in their own site. And
Yeah.
this is Monica and I were talking about this particular ophthalmologist for at least 3 months because not just you, Sherry, but I know a few other people that want to give us studies, and Monica knows even more people that want to give us studies. If we can get a damn ophthalmologist, but we want one in Southern California, like in Orange County, preferably, so that we can partner with them. Um,
Let
because
me
those studies are good. Those are good budget studies.
Yeah. Well, let me talk. Like I said, my husband's visually impaired. He has something that's called keratoconus.
Okay.
So we deal with some very well recognized ophthalmologists and corneal specialists, um, and have been with them for years. So he's got like an inroad to like Dr. Hanush, who is like one of the leading ophthalmologists and corneal specialists at Will's Eye.
Okay. Wow.
And so then he has Dr. Newsidle, who's very close to us, who is kind of buddied up with Hanush. and Hanush does studies. Not much I do now. But he does them through Will's eye. And I just really don't want to get involved with that big of an organization. I want to pull this out for me, and what I'm trying to do. And so I think maybe Hanush would be, or Newsidle would be a very good ophthalmologist, and he's very prudent, and I think he's really thorough. So I'd like to say, hey, look at this. And who do you know in California?
Exactly. Thank you. This is why these meetups are so important. And we know a guy who's purchasing. Oh, we all know Dr. Al, right? He came on last week. So he's purchasing. He's an oncologist, but he's purchasing an ophthalmology clinic. And I guess the price was right. He was having me help with negotiating, and it looks like they took my advice, and the guys accepted the offer because I think I have no way of knowing, but I think they got in over their heads with debt, like too much leverage for the site, which brings another point of topic that we can discuss because, these guys had like 4 studies, but they had like 12 coordinators, which makes no sense. Like that ratio is unbelievable. I mean, you can have one coordinator massaging the other one while they're doing the work. It's like, why do you need that many staff? Like, I understand most of the time the coordinator is overworked, but in a setup like that, that's crazy. And it sounds like these people just didn't want to let people go, which I actually had a big problem with when I started out as a site owner in last decade, from like '06 till 2010. I was really like didn't want to let people go. This is one of the reasons why the recession almost bankrupted my site. Luckily, it's not. It's still around, all 3 of them. But I didn't want to let people go. Like, I made that mistake, but I'm glad I got that out of my system because when the time is right, you just got to do it. Otherwise, you get in trouble, and now you lose all your leverage. And now you basically become an employee for somebody else who comes in, which defeats the purpose of you building a site to begin with, right? So that's a good another topic for site owners. Like, look, you don't want your coordinators overworked. You want to hire slow and fire fast. And most people do the opposite. They hire fast and fire slow.
Well, what do you see as a
That's
reasonable ratio?
Depends on the protocol. I mean,
Okay.
but I think no matter the complexity of the protocol and no matter the enrollment, I mean, as long as you're an average enroller, your site is an average enroller, even above average enroller for 3 studies, I think one coordinator can handle that. I think if you're less on the enrollment side, that one coordinator can handle a couple more studies. It's really after that 3rd study, if you're truly like above average enroller, that you need to start bringing in help. And these guys had like 4 studies and 12 coordinators, which made no sense at all. Like,
Wow.
yeah. So, but I think Dr. Al ended up getting a good price. I don't know. I'm out of the loop now, but I was helping him set up the negotiating for like what to do. So, yeah, I mean, I've seen it before. Like, I've lived it, so I know what these people are going through. Like, anytime somebody wants to be an employee that used to own a site or currently owns a site, it means that they're got over leveraged, and usually is what it means, in my opinion. Because most site owners are not going to want to get acquired by someone and then be an employee, like just be on payroll. Usually there's a contingency like 2 years, 3 years, and then you get your buyout. But anybody who doesn't even negotiate that point and just wants a salary, I think is in like some financial trouble. So this is happening right now to a lot of sites. Not the majority, but a lot of sites are in this situation right now because they were a little bit over leveraged and they didn't have enough cash on hand. And, I think a lot of sites are going to be closing. Like, not as many as '08, but a good amount of sites. And yesterday I did a video on why it's never been a better time than now to be a research naive physician.
That's what we
Because
were talking yesterday.
yeah, look at all the forces here, supply and demand. First of all, before coronavirus, you had all these studies, a record year. 2020 was going to be another record year for clinical research, and it probably still will be, even with this shutdown, which is going to say a lot about 2020. Patient recruitment was nowhere near enough. I think 90% of studies were behind on their recruitment, and this has been a trend since the beginning of clinical research. So now you're removing some sites, and a lot of these sites that were over leveraged were higher enrollers. So now you're losing some of those sites because they're shutting down. Now you're having even more studies getting started in the summer and in the fall. And so look at all this pressure on the demand for patients, which is where they're going to get from the research naive physicians if they're actually clinicians in the community.
Yeah, I think that's what's going to happen. And now these naive doctors are going to have the best opportunity to get studies right now.
Yeah, absolutely. Viva Vault. I'm answering somebody's text. Viva Vault. We're going to be using there, and Monica. They actually do for sites. You can do e-regulatory for free on a Viva Vault, but I know we're using Interlinks because we have them.
Right.
But Viva Vault's doing it for free, and they've been doing this for the last year. So
So, oh,
yeah,
oh,
what do you
okay.
guys think of that? Anybody work with Viva Vault before?
I've used it. I liked it.
It's good.
It was a good platform. I was going to tell you, I just saw an article by Global Data put it out today, and they did the overall impact of COVID for clinical research. So right now they're stating that there's 67.3% of all the studies in the US, well, it could be globally, I have to go back and look at it, are suspended, delayed, and not starting. And I think it was 42% of that, or no, 28% of that was phase 2 studies.
Hmm.
So
So
that
what was the
phase
first number? What was the first number?
67.3% of clinical
Wow.
research has come to a grinding halt.
Yep. Yep. It makes sense. I mean, and so in this 67.3%, we're not counting the studies that are ongoing and the sites are just maintaining by having patients seen virtually and all that. They're not counting that, right? They're counting like there's nothing going on.
Right.
Wow. Yeah, that's but look at all that pent up interest and demand that's going to occur like in July, August, September, like when those studies are coming back. Plus now all the new studies that are going to come.
Yes.
Hopefully even
And all this,
earlier, hopefully June. June, I think June. I mean, we're only in April 21st. Like I think by June 21st, people are back at the sites. They might be wearing masks, maybe some people hazmat suits, but we're back at the sites.
well, I'm fingers crossed. May 27th, 28th, I'll be able to get into New York.
That's right. You monitor there, right?
Yep.
I monitor in San Francisco, which is nowhere near as badly hit. I mean, it's done really well. But yeah, they're very strict. That's probably like, besides New York, probably the strictest place.
Yeah. I was monitoring over on Webster in San Fran
Okay.
before all this hit.
Okay.
Yeah.
Yeah, I'm UCSF, and Friday I'm doing a remote monitoring visit. So that will now be my second remote monitoring visit ever done. But let's see how it
Really?
works. Yeah, well, if you don't count my own CRO, because that's all basically remote now, but like external projects, like not things through my CRO. So yeah, interesting.
I back and forth with whether I like it or not. There's just something to be said about being at site and having a little bit of more access to things. Remote, you only have what's sitting in the EMR for the most part.
Yeah, I'm back and forth. I'm back and forth too. I think the like not having to travel is nice. But if it's only an hour flight to San Francisco, I mean, it's not bad. But I do think sites are much more compliant when you go in person.
Yes, yes. I think there's
You know,
something to be said about that, you know.
it's very easy to ignore an email. It's very easy to say yes on the phone and then hang up. But if I'm in your face, you could be wearing a mask. I could wear a mask too, but we're in each other's faces. You can't hang up on me. I'm right there. You cannot just shake your head and say yes. Like there, and then I could walk to your office and get it done with you. So, yeah, there is something to be said about being in person, but it's early. I mean, let's see which one works out better. I think elements of both will exist in the future.
I think we're going to have a definitely a new version of our reality coming out of this.
Absolutely. Absolutely.
Definitely.
Anybody else? What do you guys got going on? Is everybody getting the email notification for this meeting? Because I think a lot of people are not getting the email notification, and I don't know what to do about that. But Chris said he didn't get it.
No, I have never get. Oh, I don't know actually.
I have to go back and look, but it's funny because yesterday I got on for like a half a second,
Mhm, mhm.
and when I went to go log back in, it wouldn't find the conference.
Wow.
I think
Interesting.
I have been using the first one, the first link you gave us.
Okay.
Yeah.
That's
Yeah.
it.
Something happened after last week where people were not getting the notifications anymore. So I have to go on Instagram and tell people all the time, hey, come on, let's do it. But we always have our regulars. We're always going to have special guests. Maybe we'll have Dr. Hazen again when she's ready to go on a full PR blitz campaign for her 3 coronavirus protocols. Um, but yeah, what else is going on, guys? Jeslyn, Stephanie, who else? What do you
I
guys up
was
to? Monica?
I was reading yesterday. Actually, I was looking at recruitment stuff, and I came across something that it brought my attention, and I think that will work for research, which is pairing marketing strategies with PR strategies, because the PR will improve the image of research out there. So, for example, if we're doing a marketing strategy I mean, I always mention the same kind of condition is because it's really difficult to find patients for, which is, for example, Alzheimer's. So, if the sponsors, besides having the marketing strategy paired with a PR strategy, I think it will be more successful.
Yeah, PR, like there's fans of PR. I'm personally not. But hey, obviously people do it because it works. So I don't need to be a fan for it to be a good strategy. I'm just personally not a fan of PR. I'm a fan of blogging, making videos, podcasts, providing value, just doing a PR all the time, but without doing a PR. Like, the PR is to help somebody else with something that they need help with or to inform. But yeah,
But they will build like a good. I mean, it's like they have their own ways to make this or a study or even pharmaceutical in general to look better. I mean, it's not that they are saying lies, but it's just the way they expose this to the public, which marketing is just like trying to engage, but not always. Um, it sometimes it looks like it's just that marketing. I don't know if I'm transmitting the idea the way it should be. While PRs, they also use a lot of communication and build the maybe the education or the whatever they are trying to do PR on, and make it look or show the positive out of it.
yeah.
Well, Alzheimer patients, right? Is that what you're looking for, or for recruitment in particular?
No, I was just educating myself.
Okay, I was gonna say because Alzheimer's patients, I think they're easy to recruit. You know, adult daycare centers, community centers, Meals on Wheels. Ask them if you can put a flyer, with the meals that they're serving. Talk to some of their
Yeah,
drivers. They're
yeah,
seeing
we
these
actually
patients.
did. I mean, in the past, I normally mention Alzheimer's is because in the past we had Alzheimer's studies, and I mean, a lot of different strategies. And one of those was going to senior centers, do presentations. I went to facilities. I did lunch and learns. We went to um, or like senior living arrangements, like 50 or 60 and up.
Mhm.
Complex where you can go and do presentations. And I mean,
Right.
I did a lot of that, but it was hard to get patients just because unfortunately people think that they are being guinea pigs. So that's
Right.
why I was mentioning the PR, because the PR just when they help in the design of the marketing strategy, they put words, or the strategy becomes it's different kind of a strategy, so it will help to show them the positive out of this, and try to kind of erase from their mind that
Yeah.
that idea that people have about research, that they are guinea
Right.
pigs.
I think something that really damaged this industry, just in the very recent past, was an ad campaign that was out. I think it was for Jewel.
Oh yeah, the vaping
One of
people. Yep.
Yes, and they had all those freaking hamsters and guinea pigs running around, and said, "See, they're experimenting on you. They're making you look like guinea pigs." And I was livid when I saw that. All the painstaking efforts that we've made in this industry to take that stigma away, to keep that out of research, and they went right back in and got advertising out there to do it. And I thought,
It's
that's
so
horrible.
difficult.
Well, they're
Yeah,
getting
that's
their they're gonna have their day in the sun because yeah, the government's coming down hard on them. They came down pretty hard on all the vaping companies. They got a lot of studies they have to do now. Ironically, now they have to do clinical trials. So how are
Mhm.
they going to enroll patients when they just did that? It's like nobody's going to want to join your study. If your branding was successful, everybody saw that, and then, so hopefully your branding wasn't successful so that you
No, no,
can.
no. It was an anti-vaping campaign from somebody.
Oh,
Yes, but the fact that they used guinea pigs as, in your words, the leverage to get their point across, it was horrible.
I
I,
got
I mean, I cringed when I saw it.
I got you. I got you.
yeah, we're like that was the perfect word, Cherry, when you say we're being stigmatized, like forever.
Yeah, and I
So,
mean,
so that's
so
why I
those
think it's important for sponsors to
right.
involve PRs in this, because I mean, if we don't do it together, it's going to be really difficult for only one person to try to change the image and the bad reputation of this stigma that we have.
Yeah, that's right. That's absolutely right. And, I think as far as coronavirus, I think now clinical trials is, the stigma is going to be a little bit different.
Yeah.
Now people are truly seeing it as something we need, even though they say the peak is, we're past the peak, whatever. Second wave. Don't listen to the media. They're going to be hysterical. As soon as one person dies from a second wave, they're going to say the new wave is deadly. I mean, they're in the business of getting views, but I do think coronavirus has shown the importance of medical research to the world at scale like we've never had before. Talk about PR campaign. This was like
That's
the
it.
perfect PR campaign
Yeah.
Yeah.
That's
for
right.
clinical research, and it wasn't free. Nothing's free, guys.
Yeah.
Our freedom is not free, but we didn't have to pay for it, And now I think in a post-corona world where you go out and you tell people what you do clinical research, they're gonna understand a little bit better, I think.
Yeah, at
Right.
least
But
they will know what it is about, and that we need it before we get any type of treatment out there.
well,
Yep.
the panic though, and this kind of goes back to the 80s and 1985 when AIDS was the big thing. How many people were out there screaming, "We're dying, do something. We're dying, we need drugs. Find us something." And they expedited it. And do you remember what happened afterwards? They got kicked in the tail, and the same people that were screaming, "We're out here dying," said, "How dare you? You're poisoning us."
Mm.
Because the first thing they came out with was AZT. And AZT started out literally as an industrial drain cleaner.
Wow.
And they said, "Look at what you're giving us, and you're killing us." Now
Sure is always educating.
Yeah.
listen, I remember that whole time period very vividly and how terrifying it was. And more so for me than I think a lot of people, because I had a son who was getting blood products.
Mm.
And nobody knew how to test it. Nobody knew where it originated from or what it was. And it was elusive. It was mutating exponentially. So I mean, I really paid attention to what was going on. It was scary. I mean, that was a really scary place to be during research, and to see the sides. And I felt bad because the Kaposi sarcoma and the deaths. And I mean, you guys, your generation or your age group, it's Freddie Mercury. That's your totem pole for AIDS because he died of it. And look what it left him looking like. Now, had he been diagnosed 10 years later than he was, he'd still be here.
Yeah, Magic Johnson, right? The difference between him and Magic, I guess.
Yeah. Yeah. I mean, that did a lot for our industry, but it also did damage because of the expedited trials. And now here we are in the same situation with expedited trials. Record-breaking FDA approvals on clinical research.
Yeah,
There's
we started the call with the one that we're doing. There's probably tons more. I'm on clinicaltrials.gov every day, emailing at least an hour for our hybrid virtual trial model. And I'm seeing a lot. I'm seeing a lot of COVID-19 studies. Like there's tons of them, guys.
Around the world, there are 621 right now.
Is it 621? When I first looked, it was like 243, and then I was like looking, and I was like, "Oh, look at that! Egypt is studying honey."
And guess what, guys? We'll end with this because me, Monica, and Chris have to jump on a call because there's some important stuff to discuss. But we'll end it on this: with all just coronavirus studies right now, from those 600 whatever, I'm on one that's free. There's no budget. It's just people volunteering. What better time to learn the industry and be an intern and see where you fit in? Get in how you fit in. I mean, if you're in the CRA Academy or CRC Academy, you don't need to do that. You're going to be spoon-fed this stuff. But if you're not and you want to, this is what you do. Clinicaltrials.gov, just like I do, every day for an hour. Talk about who you are, what values you can add. From those 600 you email, probably 3 of them will reply back, and maybe 1 will turn into something for you in the internship. So we gotta do a hard stop because me and Monica and Chris gotta do a call. But guys, share the link with your friends. People are not getting the email reminders, so share the link with anybody. I'm gonna try to get, not tomorrow because tomorrow it's gonna be hectic, but sometime this week, maybe Thursday, I'm gonna have a guest come on as well, because those are fun. Those are fun to have Darshan, Hazen, people like that, Dr. Al. So thank you everybody very much. Until tomorrow, stay well.
Yeah, you too. Adios.
Bye.
Bye.